your videos. Turn on your videos. In the last class, we were discussing about shock, right? First aid theory, we were discussing about shock, S-H-O-C-K, shock. So now let us, someone read the last class, whatever we have studied. Read out the signs and symptoms of shock. Read from the factors influencing the degree of shock. You read from there. Anyone can read out? Factors influencing the degree of shock. KV, you read out the factors influencing the degree of shock. KV. KV is present or absent?
Yes, ma'am.
Read out the factors influencing the degree of shock.
Factors influencing the degree of shock. Pain. It increases the severity of shock. Number 2, physical condition. People who are starved or exposed to extremes of cold or heat go into shock easily. Number 3, fatigue. It increases the severity of shock. Number 4, diseases. People having chronic diseases develop shock easily. Number 5, individual reaction. Shock varies from person to person. Number 6, improper evaluation, care, movement. Shock may be increased by rough handling and delay in treatment.
Okay. Who is there? Rudolph is there? Present? Rudolph Sweet. Rudolph, you read out the sign and symptoms of shock. Yes. Rudolph, you read out the signs of shock. Absent or what? Marwood Kiru, you read out otherwise. The signs of shock. Only the signs, okay? Symptoms I'll ask somebody else to do.
Sign. Casualty is anxious and restless. Number 2, weakness, fainting, and disorientation. Number 3, shallow, rapid, or grasping breathing. Number 4, nausea, vomiting, or extreme nausea.
What is the meaning of nausea? Marwood Kiru. What is the meaning of nausea? What is the meaning of nausea?
Lack of blood.
No? Nausea means lack of blood. No. Very much wrong. Nausea means feeling of vomiting. Okay, it is just a feeling that you want to puke. Feeling of vomiting. It's just a feeling that you want to vomit. Like for example, when you are sitting in a bus, some people like they have a tendency to vomit, but they doesn't do that. So that tendency which we have for vomiting, that is known as nausea. Vomiting means what? We have already vomited. Okay, but nausea is just a feeling like you want to vomit or you want to puke. Okay, read out nausea, vomiting, then
or extreme. Number 5, skin become pale, cold, and sweating may develop.
Okay, now for symptoms, Sriyam, you read out the symptoms of shock. Sriyam. Present or absent? Sriyam is present or absent? John Deep, you read out the symptoms of shock. John Deep. Who is Lakme Chakma? Lakme, who is Lakme? Lakme, you read out the symptoms of shock. Read out fast. We are wasting time. Okay, Sakani, you read out the symptoms of shock. Maybe they are having network issues. You read out the symptoms of shock. Sakani Rabiang.
Symptoms. Number 1, pulse rate increases but weaker. Number 2, blood pressure falls. Number 3, pupils are dilated. Number 4, shaking and a trembling of arms and legs. Number 5, unconsciousness may develop. Number 6, evidence of associated external or internal injury.
Okay. Now write down types of shock. There are 8 types. Okay. Write down types of shock. Types. TYPS. Types of shock. Types of shock. Number 1, you write neurogenic. Number 1, neurogenic. NEUROGENIC. Neurogenic shock. NEUROGENIC. Neurogenic shock. 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 Put a dash and write down spinal or head injury. Spinal, SPINAL. Spinal or head injury. Spinal or head injury. Head, Moore, HEAD, head, means your head. Head injury resulting in loss of nerve control. Resulting, RESULTING, resulting in loss of nerve control.
Resulting in
Loss of nerve control.
loss of nerve control.
Full stop. Nervous system loses control over. Nervous system nervous system loses control, CONTROL, control over vascular system. Loses control over vascular system. Over vascular system. Full stop. Blood vessels dilate. Blood vessels dilate. DILAT. Blood vessels dilate. Blood vessels dilate, and there is insufficient blood to fill them. And there is insufficient blood to fill them. So what will happen in the neurogenic shock? It also in the neurogenic shock, what will happen whenever there is an injury, okay, either on your head okay, or in your spines, what will happen at that time? There will be a loss in the nerve control, because all this comes under your nervous system. So all this will lose control, okay, which will result in the blood vessels dilating. The blood vessels will become dilated, and because of that dilation, what will happen? There will be an insufficient blood. How much blood is required to pump and function in your body? That will lessen, okay, that will become insufficient, okay. And the nervous system, what it does is it lose control over the vascular system. So what are the vascular system? Vascular systems are those systems that it will carry blood, okay, blood and lymph through your body. It carries blood and lymph through the body, okay. Like for example, your respiratory system, your digestive system, your kidney system, okay, urinary system, all this comes under your vascular system, okay. So all this system will lose control, okay. The nervous system loses control over all these systems, because of which, why it happens? Because the blood vessels dilates, and because of that dilation there is insufficient blood to pump or to function in the body, because of which this shock generally happens, that is known as neurogenic shock, okay. Number 2, you write down hemorrhagic hemorrhagic shock. Hemorrhagic, HAE HAEMORRHAGIC HAEMORRHAGIC hemorrhagic shock, SHOCK.
Ma'am, hemorrhagic shock.
Hemorrhagic shock, hemorrhagic, HAEMORRHAGIC, hemorrhagic shock. What do you mean by hemorrhage? We have even finished, almost completed hemorrhage. We have completed hemorrhage. What is hemorrhage?
Bleeding.
Yes. So write down, put a dash and write loss of blood due to wounds. Loss of blood. Loss of blood loss of blood due to wounds, WOUNDS, due to wounds, comma, internal bleeding, internal, INTER, internal bleeding, multiple trauma and severe burns. Multiple trauma and severe burns, BURNS. Even burns also we have completed, right? So you know what is a burn.
Ma'am,
So hemorrhagic, say,
internal bleeding,
multiple trauma and severe burns. Trauma means what? Multiple injury to the body, okay. Multiple injury to your physical self is known as trauma, okay. And severe burns, whenever there is internal bleeding, whenever there is a loss of blood, okay, too much loss of blood is known as hemorrhage. Hemorrhage is also known as bleeding. So you have already known what happens when there is a hemorrhage. Tell me. You already know. Anyone still remembers? What are the effects of hemorrhage? You have already learned the effects of hemorrhage. What happens? Whenever there is a loss of RBCs, what happens? Whenever we have excessive loss of RBC, that is your red blood cells, what it causes? It causes a lack of oxygen in your body, right? And whenever there is a decrease in the blood volume, whenever your blood volume decreases, what it causes? It increases or decreases your blood pressure? It will increase or decrease? Yeah, it decreases. And whenever your heart's pumping rate, you have written all of these things. Whenever your heart's pumping rate will increase, it will, the heart's pumping rate increases. Why? Because of the reduced blood pressure. Okay, because of the insufficient amount of blood that is required to function normally for the body, as it becomes so less, that's why the heart's pumping rate will increase. It will go more than the normal. Okay, so that is known as hemorrhagic shock. Whenever there is an excessive loss of blood due to any kind of wound, okay, any type of injury, any internal bleeding, okay, physical injury to the self, any kind of trauma or severe burns, it will it will lead to hemorrhagic shock. Okay. Number 3, you write down respiratory. Number 3, you write down respiratory. Number 3, respiratory shock. Respiratory, R-E-S-P-I-R-A-T-O-R-Y. Respiratory shock. Put a dash and write down. There is an insufficient amount of oxygen. There is an insufficient amount of oxygen. There is an insufficient amount of oxygen put a dash and write. There is an insufficient amount of oxygen. There is an insufficient amount of oxygen in the blood, due to inadequate breathing, B-R-E-A-T-H-I-N-G. There is an insufficient amount of oxygen in the blood due to inadequate breathing or respiratory arrest. A-R-R-E-S-T. Or respiratory arrest. Am I audible, Sakani?
Yes, ma'am.
Am I audible? Okay.
Yes,
So
ma'am.
write down respiratory shock. There is an insufficient amount of oxygen in the blood due to inadequate breathing or respiratory arrest. Respiratory arrest means what? The patient might the patient's breathing might stop. Okay, arrest means what? The breathing might stop, or there might be a lack of the amount of oxygen that the person needs to respire, that might become insufficient. Okay, so arrest means usually stop. Okay, so below you start with a bulletin, put a dot, bulletin, write down spinal injury. Spinal injury, start with a bulletin, put a dot, spinal injury. Second dot, obstruction of airways. Obstruction of airways, AIRWAYS, obstruction of airways. And the last you write, last dot, chest trauma. Last you write down chest trauma, TRAUMA. I've already told you what is a trauma. Okay, so respiratory, what happens whenever there is an insufficient amount of oxygen, okay, in the blood due to respiratory arrest, or because of spinal injury, or because of any kind of obstruction in the airways, or because of trauma in the chest, what will happen? It might lead to respiratory shock. Okay, number 4, you write down psychogenic shock. Psychogenic shock. Psychogenic shock. Psychogenic. PSY. PSY. Psychogenic. PSY. CHOGENIC. Psychogenic shock. PSYCHOGENIC. Psychogenic shock. Put a dash. Put a dash and write down. Something psychological affects. Something psychological. PSYCHOLOGICAL. Something psychological affects. Something psychological affects the patient. Something psychological affects the patient. Something psychological affects the patient. Comma, that is, comma, that is death of loved one, death of loved one, LOVED, death of loved one, LOVED. So, excuse me. Death of loved one, comma, accident, etc. Accident, etc. ACCIDENT, accident, etc. Comma, blood drains from the head. Blood drains from the head. HEAD. Blood drains from the head. Blood drains from the head and pools in the abdomen. And pools, POOLS, and pools in the abdomen, comma, person faints due to, say, some of you keep your videos turned on so that I can see you. Blood drains from the head and pools, POOLS, okay, not PULLS, POOLS, and pools in the abdomen, ABDOMEN, and pools in the abdomen, comma, person faints due to lack of blood in the brain. Person faints, FAINTS, faints. Person faints due to lack of blood in the brain.
Ma'am.
Pools in the abdomen. Pools in the abdomen, comma, person faints due to lack of blood in the brain. So what do you mean by psychology? Okay, what is psychology? It all depends on the person's emotions, feelings, sentiments. Okay. See, something psychological affects the patient. Okay, anything that is related to the brain. Okay, whenever a person is affected by something, it might be, that's why I've given you an example. That is death of loved one. Whenever someone near or dear one has passed away. Okay, or when somebody convicts you of something that you have not done. Okay, or else any kind of accident. Okay, you don't know the person might be a stranger to you, but if you see someone dead near your eyes, that might cause a trauma in your head. Okay, it might give you some push in your brain. Okay, all your nerve systems will create impulses. Those impulses might cause lack of oxygen in the brain. Okay, because of the trauma that you had faced at that time, at that point of time. So that is known as the psychological effects, and because of this also people get shock. Okay, they get shocked because of all these. That's why I've given death of loved one, accident, etc. What happens is that there will be a lack of blood in the brain. Okay, because of the nerve impulses, the nerve endings always have impulses in them. Okay, if all those things becomes too much in excess, or it becomes too much less, then obviously there will be a signal that goes to your brain, and then it causes the reaction to the person. Okay, so that is known as psychogenic shock. Okay. Next you write number 5th point, cardiac shock. So see, for psychogenic, you all should, as you all are very young, okay, you all are young and fresh. So all these small things should never hamper you in anything. Okay, you should be clear in your vision. Okay, because at this age, what happens is that if somebody says something, you might mind soon, you might feel bad soon, you might be too much happy, because your emotions are too much high at this specific time period. So there should always be a limit. Okay, not too much of excitement, not too much of sadness, depression. Okay, all these things should never come into your life. Try to stay away from all these things. Try to lead a very healthy and happy life. Okay, study well, do your things well. Okay, and try to always move forward in your life. Okay, don't let the simple and small things convict you for anything. Okay, because there are lots of things, and there are lots more to go in your life. Okay, so always be healthy. You all know what is health. Okay, physically fit, mentally fit, spiritually, emotionally healthy. All the combination of this is a package. Okay, you will get in a package. So this thing should be in you. Okay, not only physically healthy, but mentally, spiritually, emotionally, you should be healthy. Okay, in all the aspects. Why I said about the psychogenic shocks, psychogenic especially, is that because you all are young, you all are youth. Okay, you all are young. Okay, so try to be a good citizens, try to be a good persons. Okay, next you write down cardiac shock. Next, number 5th point, you write cardiac shock. Cardiac shock. Put a dash and write cardiac muscles not pumping effectively. Cardiac muscles not pumping effectively. Cardiac means what? It relates to your heart. Cardiac muscles not pumping effectively due to injury, or previous heart attack, due to injury or previous heart attack, or previous heart attack. Full
Ma'am,
stop. Hmm? Hmm?
your voice is not clear. Effectively
Now
due
is it
to
okay?
injury. Yes, ma'am.
Effectively due to injury or previous heart attack, or previous heart attack, ATTACK, or previous heart attack. Full stop. The heart muscles no longer imparts, the heart muscles, the heart muscles no longer imparts, the heart muscles no longer imparts, IMPRTS, imparts sufficient pressure to circulate the blood, imparts sufficient pressure to circulate the blood, BLOOD. No longer imparts sufficient pressure to circulate the blood. Okay, and about heart, about your cardio system, I guess you have already studied in your anatomy and physiology, so I guess you will know more than me, right? I guess you all will know more than me, so I don't need to explain you much about the cardio system. Okay, because your teachers already explained you, I guess, about your cardio system, cardiovascular system. So I don't need to repeat it again. Okay, but I'll just tell you in short that in cardiac muscles, okay, what is a cardiac shock? A cardiac shock is when your heart's pumping rate, what happens? It's not, it decreases when the heart is not able to pump properly. Why? Because of maybe injury, or because of your previous history, your past history of heart attack. Because of all these, your cardiac system or your muscles, that your cardiovascular muscles are not able to pump the blood properly. Okay, because of which you might have a cardiac shock. Okay, which might ultimately lead to death of the person if early treatment is not provided. Okay, next you write down metabolic shock. Number কিমান আছিলে 1 2 3 4 5 6. Number 6 you write metabolic shock. Metabolic shock, put a dash and write Loss of body fluids, FLUIDS, loss of body fluids with a change in biochemical equilibrium,
Ma'am, body fluid.
equilibrium, that is body fluids with a change in biochemical
Ma'am, your voice is not
equilibrium, with a change.
Ma'am, your voice
Now
is
is
not
it
clear.
okay? Not audible?
Now, yes, ma'am.
Now is it okay?
Yes, ma'am.
Okay or what, Sakani?
Yes, ma'am.
Okay, only 4 minutes baki ase. Only 4 minutes is left. Write fast. Loss of body fluids with a change in biochemical equilibrium. That is shock, insulin shock, sorry. That is insulin shock.
Ma'am,
INSULIN. That is insulin shock, comma, diarrhea, etc. Diarrhea, etc.
Ma'am, can you repeat again?
So in metabolic shock, okay, you write loss of body fluids with a change in biochemical equilibrium, that is insulin shock, comma, diarrhea, etc. Okay, so whenever there is a change in the equilibrium, okay, what will happen? It will lead to loss of body fluids, and because of which the metabolic shock might increase in a person. Like for example, that is in diarrhea. Okay, in diarrhea, what happens? What is a diarrhea? What is diarrhea? Srijana, what is diarrhea?
Dysentery?
Yes. No, why? Diarrhea and dysentery, many people get confused with this thing. We have one chapter also on diarrhea and dysentery. Diarrhea means vomiting.
Loss of
Ki? Diarrhea means patla paikhana. You don't know? Loose motion.
oh yes.
Diarrhea is loose motion, okay? And dysentery is what? Many people, what they say, diarrhea means dysentery. They used to answer in that way. No, diarrhea and dysentery are two different things. In diarrhea, you will have only patla paikhana, okay? Loose watery motion, okay? Loose stool. And in dysentery, what you will get? There will be a loose stool, patla paikhana. Along with that, you will get blood. Tezu ulabo, okay? There will be blood, loss of blood and mucus. That is known as dysentery. Diarrhea means only loose motion. Dysentery means loose motion. Along with that, you will get loss of blood in the stool, okay? And also, there will be presence of mucus. Okay, that is known as dysentery. These are two different things. Okay, so so too much loss of body fluids can lead to metabolic shock. Okay, like for example, insulin shock and diarrhea. In diarrhea also you will have loose motion, so because of that. Okay, now less than 1 minute baki ase, you join again. Join Korako and thank you. Leave the meeting and join again. Aro, please attendance give me the attendance.